This week on the Steele Report, with the pandemic continuing on, we'll see what's happening inside an area senior and retirement community, NewAldaya Lifescapes, with CEO Melissa Tierney. And our program begins right now.
Now from KWWL, this is the Steele Report.
Well, right now I'd like to welcome to the Steele Report for this week the CEO of NewAldaya Lifescapes, and that of course is Melissa Tierney. Melissa, thanks for taking the time to be on the show today. And what I want you to do right away, and this is going to be difficult to do, but describe NewAldaya Lifescapes as it was before COVID. Tell people what you do. You're a retirement community, we know that, a senior living facility with so much more. So tell us really what NewAldaya is all about, and let's forget that COVID's going on just for a moment.
That's a great question, Ron. You know, it helps me feel good inside to think about pre-COVID. Well, NewAldaya, as you said, is we're a life plan community, and what that means is we offer individuals a plan for their life, and we do so by providing choices in a variety of ways. Lifestyle options that could be residential neighborhoods to hospitality services, to assisted living and healthcare services should needs change, and about everything in between. And so we are very much a community blended model. Our Main Street was launched in 2011, and with that, the Live Better, Live Well program. And our vision was to advance the standards for moving the aging paradigm forward. And we were able to do so. Now during the pandemic, you know, things have changed right now. It doesn't feel like we're advancing our standards. So it's been an interesting time.
Do you fall under some of the same rules that the long-term care facilities would fall under? And kind of you explain that if you can, Melissa.
Yes, that's a good question, and many people don't understand some of the differences, but because we are a community providing a number of resident services in different settings, we do have a healthcare facility that falls under the long-term care licensure guidelines. We also have the BRILE, which is an assisted living program, which has its own set of laws and rules, and then our residential communities follow the same laws and proclamations that we all follow as private citizens. So we are constantly balancing on our teeter-totter of resident settings, and therefore the abundance of regulations and rules and proclamations that are moving with us during the pandemic.
Your residents are going to fall into the category which would be considered high risk for the most severe illness that COVID brings along with it. So tell us kind of a little bit about a typical resident who lives in one of your facilities. And you have assisted living, of course, you have independent living, you have all the things that you mentioned, but is there such thing as a typical resident for NewAldaya?
Well, you know, typical resident, you need to be careful. Everyone is very unique, Ron. And we certainly feel that they are, but our residential neighborhoods, you know, we have people that live with us as young as 55 and all the way up into maybe their upper 80s in our residential neighborhoods or early 90s. So that's your demographic there. Those folks, you know, are independently making decisions and living their lives. They're just using some of the services that we have to make life a bit easier for them. The BRILE, or the assisted living program, generally these folks are needing a little bit more assistance, but they still are independent within the program. Assisted living actually falls under landlord-tenant law, but they need some extra help. And then of course, the nursing facility, the healthcare side of things, you know, folks that are in the healthcare area need healthcare assistance. That's why they're there. So that typical resident would be needing professional healthcare services in their daily lives for the time that they're here, because as you probably are aware, in the healthcare facilities, we have people who live with us in our extended care area that need long-term care within healthcare. And then we have a lot of folks that come and go as what we call a short-term stay. They're coming for, you know, a stay for some rehab or some extra services to strengthen them following a hospital stay, for example, and then they're returning to home, whatever that may be. So that's probably a general synopsis of the type of folks that we're serving on any given day.
So let's talk a little bit. Have you had any cases that you've had to deal with among your residents or your staff, and how have you dealt with that?
Well, it's been an interesting journey because we actually had, when the first Blackhawk County surge, Cedar Valley surge occurred in April, we knew we were going to be threatened uh, at that point, and our first positive staff case occurred on April 23rd. And thereafter, our first resident positive case occurred in the healthcare facility on May 4th. We did manage the outbreak successfully. It was on one resident or one neighborhood within the healthcare facility. And I'd like to remind the viewers that from our perspective, I had been receiving guidance since March 7th, I and my team, and actually putting the pandemic plan into place. We all had emergency pandemic plans, but the COVID pandemic plan was really being written day by day. And at one point within the first, I think, 10 days, there were over 100 new issuance of guidance that came our way that had to be executed and implemented. Also, at the end of April, I'll remind the viewers, most facilities did not have adequate PPE for our staff to be protected and/or our residents. And I often wonder if we'd have had what we really needed, if we could have mitigated those cases. So all in all, we had about 23 residents in one neighborhood over a month that contracted the disease. The other thing I thought has been extremely interesting as we've gone through 9 months is we as providers were learning ahead of the CDC. So the CDC guidance, doing the best they could at the time, was there, but our realities in executing and fighting the virus were giving us a whole different picture, and I'm referring to asymptomatic transmission. At the point of our breakout during May, you weren't hearing a lot about asymptomatic transmission. The guidance said, move your residents as soon as they're symptomatic. Well, we learned very quickly during about a week period that is not how we were going to be successful in managing this. So we started doing, quote unquote, kind of our own thing at that point to really determine asymptomatic residents who were unknowingly transmitting to their neighbors in the healthcare facility. Once we did that, then we were able to really manage and mitigate the spread. It never went beyond another neighborhood. So then we'll fast forward, and again, we have another community surge happening in Blackhawk County, far greater than the first time. We're much better protected with our PPE supplies. We've been executing our standard precautions and COVID precautions extremely well. Our staff are doing a fabulous job, and we have had an uptick of our staff cases, but we've been really able to mitigate the occurrence of resident cases, which is an interesting thing to think about this time around. So staff are wearing PPE. We're testing. We do over 800 staff tests a week because of the positivity rate. And if one staff person tests positive, then we must test all of our residents residing in the healthcare facility as well. So then we'll test almost, 950 tests in a week. But it's interesting to me that we are really protecting or able to protect our residents from the transmission, although our staff are being impacted by community spread when they leave NewAldaya.
You have this dedicated staff, and we've seen in the hospitals they're having some staffing shortages. Have you had any shortages in your own facility?
We had critical staffing shortages at the time of the first surge because when you're, per guidance, even if the staff member had any symptoms, they were not allowed to enter property, and they were sent home under guidance. If you recall early, we weren't even testing at that point for guidance. They were just sent home and they were quarantined for about 10 days, and there's more to it than that as the guidance changed. So yes, we were quarantining a lot of people, not knowing if they had COVID or not, but they had some type of presenting symptom that may or may not be COVID. So I used the metaphor that I really felt like we were dug down in the trenches waiting for air cover and support, and it just didn't come. And our friends at Black Hawk Emergency Management were with us every day. They were doing their best. There just wasn't the resources. So we really, at that point in April and May, redeployed all of our staff. All of us were doing something on front line to make sure that our residents were cared for. You could have staff complete a certain 2-hour course so that they could do something within the healthcare facility that would be helpful to us at that point. But it was really very difficult, and we made it through that. Unfortunately, like our hospital partners, we are all suffering through it again. We are in that critical staffing situation right now, and we're trying to manage through it from what we've learned from the first time through, but it's extremely difficult. So we're all working many days, many hours, and we're not doing necessarily our regular roles in order to make sure that our residents receive the care that they need.
Melissa, thanks very much. We're going to take a short break here on the Steel Report. Reminder, our shows are online on kwwl.com. We'll come back and talk more with the CEO of NewAldaya Lifescapes in Cedar Falls. That's Melissa Tierney, so stay with us. Younger patients seem to be getting this, and is that kind of a surprise to you?
We were a little surprised, but I think this virus has been surprising all the way through. Its impact on people who may or may not have a known underlying condition versus those that do. So we were a little surprised by that, yes. You report daily.
Daily, okay.
There's a direct communication. It's changed a little bit as the pandemic has gone on, but our team and every other provider within the long-term care healthcare setting needed to have connection with the Iowa Department of Public Health on a daily basis, and sometimes we were in daily connection with our Black Hawk Emergency Management partners as well. So yes, there was a daily connection, and that keeps the information flowing. So we do have to submit that, and data is flowing into those dashboards, both at the state level dashboard, and the CDC keeps a dashboard that we submit to as well.
What are you doing to keep morale up among your staff and among the residents? Because I assume you have in place a no visitor policy still, or why don't you tell us what's going on as far as visitors and what you're doing to keep everyone occupied and kind of try to stay as upbeat as possible?
Well, it's a challenge, and because we're a community, and as I mentioned, those resident settings are different, the rules are different, the laws are different. Our Braille assisted living and all other assisted living providers early on were in the lockdown with healthcare facilities. And we thought that was a little bit over the top, since landlord tenant is within the purview of assisted living programs. That probably didn't sit very well with many of our tenants. We were able to advocate and move that forward, and the state lifted that lockdown per se in June, and then charged the assisted living providers to develop our own reopening plans based on the Center for Disease Control guidance and local conditions such as positivity rates, because there are rights involved with all of our residents. And we put together a reopening plan for both our residential neighborhoods and our assisted living neighborhoods, which is the Braille, which they're not locked down, but it is a phased plan. But there are provisions for precautions and good thinking, good information to make well-informed decisions so that they and their neighbors are safe. That has really helped the assisted living and the residential neighborhoods because we've created a safe environment, but they're not in a lockdown situation, and there are provisions there, but they still could return to some aspects of their life and should have. Our challenge has been, of course, in our healthcare facility because those residents have been in a lockdown closed setting now for 9 months.
Wow.
And it is heartbreaking. It's heartbreaking for the family, it's heartbreaking for the residents, and it's heartbreaking for all of us. We've done our very best, for visits, whether it's virtual, window visits. We created and built, little visitation huts. We're very creative in trying to allow people to see one another, adding speakers to the structures that we create so that they can hear. However, we are now in winter. And although we've been advocating very, very hard, we're not able to move this visit discussion forward. And it's somewhat like, and this is only my opinion, that the Center for Medicare and Medicaid Services doesn't quite appreciate what a winter in Iowa is. And, so it's reducing our ability to allow some of these face-to-face visits. We can do a vestibule visit because it's not actually in the licensed care area, but we can't build a wall within a hallway in the licensed care area that has a separate entrance for the visitor and would protect the residents. So those are frustrations that we move through. It also took almost 7 months for residents who reside in any licensed nursing facility in the state of Iowa to be able to leave that licensed area and go to somewhere else within the campus for salon services. And we finally were able to advocate to move that through so the ladies and gentlemen can at least get those services after 7 months in the salon that we operate. Early on, what we did, we were fortunate that we employ our stylists. So we had them certified in certain classes so they could enter the work in the nursing facility area and provide some of that grooming hair care service so that our residents wouldn't be going completely without that. But we are very happy when we could advocate it to the salon. But it's been very difficult. We're really concerned about, the balance of safety and well-being is our teeter-totter. And we're very concerned about the well-being of our residents. It's been a long time since they've been able to touch a loved one. Now we fought for and we have compassionate care visits that were expanded. But the advocacy for change, it's very important, but it's slow because, we're working with public health, we're working with the regulatory agencies, both state and federal. The state agencies, of course, are trying to oblige to the feds, and we're trying to make everybody happy. But we are really concerned about winter now and the limitations that still exist in our healthcare facilities.
Let me ask you, is there anything you would like to see the state of Iowa do which might help your situation and the situation for your staff and your residents? Anything at all?
Well, I'd like to say that I think it's been great to work with our county public health, and the Iowa Department of Public Health has been good to work with as well. But I think we're in a conundrum between, as I said, I keep bringing up our teeter-totter, that we have decided that because people live in a healthcare facility that they or their families, aren't in a position to make decisions for themselves. And so the state is making the decision. And I think that's where the crux is right now. And I know that our family members have been very actively, whether it be the governor or the Department of Inspection and Appeals, all of the agencies, they've been getting their voices known. I just think we need to get to further down the road in some compromise so that residents residing in our healthcare facilities can actually visit their loved ones. And we are not there yet. And I would say if that's the one thing I could do at this point, that's what I would want to advocate for.
Yeah, you used the word heartbreaking earlier, and that
It
is
is heartbreaking.
absolutely the perfect word and so unfortunate. I wanted to ask you this, though, given what's going on right now, are you accepting new residents at this point? Obviously, there are a lot of people who need every month a place to live, a new place to go.
Yep.
What's the situation there for NewAldaya?
Well, we've been accepting tenants for moving into the Brile since June or July. We have move-ins coming into our residential communities, which is a good thing. I think people are a little COVID fatigued. So if you've been helping to assist a loved one and you're looking for assisted living placement, this is probably the time to start looking around because many of us are not. We're safe situations, but we're not in lockdown so that people, aren't, you won't be precluded from seeing them. But yes, we've been accepting nursing facility and short-term patients and residents since July. There's been a lot of change there. We have our Unity Point partners, our Mercy One partners, and they need us to accept the patients that they're discharging, particularly now because everything's refilled to capacity at our hospitals between COVID and non-COVID care. So our part of the continuum in that post-acute side is important. So yes, we do accept admissions and have been accepting them since about mid-June in our healthcare, and June and July in the other parts of our community.
Melissa, thanks very much. We're going to take another short break here on the Steele Report. Again, our shows are online on kwwl.com. We're coming right back. Melissa, as we wrap up our interview today here on the Steele Report, what would you like people to know about what's going on at NewAldaya right now, given the mitigation procedures that are in place and what you've been dealing with the last several months?
Well, I've mentioned it several times. It's very important to NewAldaya and our vision. It would be far easier from an operational standpoint just to lock everything down and say, hey, we need to do this because you need to be protected and safe. But that isn't the easiest thing to do really, because it's not going to create well-being in people. We are human beings that really need 6 or 7 dimensions of wellness. And we need to continue to work towards the difficult task of finding that balance, which I'm proud to say NewAldaya has done. It hasn't been the easy way. It's been difficult, but I think that our residents have benefited for it. The other closing mark is I think the sociologists and psychologists are going to have some very interesting studies for us all to read and to absorb as to how society has responded to a pandemic. And I alluded to this before because immediately I felt the advances we'd made in advancing the paradigms of aging and trying to defeat ageism that still exists were completely flipped on its ear on March 7th, 2020, because rights were immediately taken away because it's better that we make the decisions and close everything down to keep you protected instead of looking at how do we balance this and do the right thing for well-being. So I think it's going to be very interesting to see the results of these studies and the reflections of all of us as we've lived through this.
Melissa Tierney, CEO of NewAldaya Lifescapes out there on University Avenue in the 7500 block. Thank you so much. Do the best you can to keep everybody safe. I know you're doing a terrific job there, and thanks for taking the time to be on the program today, Melissa. Thank you.
Thanks, Ron.
A reminder also, our shows are online on kwwl.com. All you have to do is go to the kwwl.com homepage. You'll find the watch category. Just go on down to the Steele Report. All of our programs are right there for your viewing. Thanks so much for this week on the Steele Report. We'll be back here in just a week. Thanks for watching.